Val, thanks so much for the kind introduction. A couple of things. First of all, I'm not going to talk real long tonight. I was sharing with some people during refreshments that I didn't make it very long in Catholic school. I didn't hit it off well with the nuns, but I did learn that short sermons are better than long sermons. So I'd like to talk for a little while, and then I'll open it up for questions. So if you have questions, please feel free in just a little bit to ask those. I want to congratulate all of the writing award winners, and where's Cindy? Cindy, we're going to miss you so much. The Triumph program has been incredibly successful and moving and made a difference in a lot of lives of medical students and patients. So thank you for that, and they're lucky to get you in California. So keep in touch with us. So my talk tonight, you saw the title, Beyond the Walls of Traditional Care. I want to link this back through the talk into how the Farleys influenced me. Jean and Linda were incredibly important. And I would say along my path, I've had a few amazing mentors. And one of the other amazing ones is sitting right over here, my longtime friend and mentor, John Frey. So the lessons that we glean from others, I hope we can talk about tonight as lessons that we can give back to others. So let me expound on that a little bit. First, I'm going to give you the context of how I worked with the Farleys, because I think it's important to the story. When I was a very young faculty, and I'm still young, but not as young as I used to be, we were establishing UW Family Medicine in Milwaukee. Jean Farley was chair of the department at the time, and I worked much more closely with Jean than Linda. So a lot of my remarks about tonight, about the Farleys, relate specifically to Jean because he had such a great impact on me. At that time when we were getting family medicine going in Milwaukee with a UW connection, Jean was so very generous with his time, with his wisdom and advice, with his support, and just his presence, being there. All those things were incredibly important. But the best, very best gift that he gave me was what I would say is the gift of vision. And I don't mean his vision, but the ability to help me think differently about medicine and healthcare and what family medicine could mean for populations in Milwaukee. That's a real gift. And all those years ago, what he helped to embed in me is now playing out in a variety of ways that I want to talk about in healthcare in Milwaukee. But that is how I'd like to think about tonight. An honor to the Farleys for giving us all vision, and their impact is going on now and will go on for generations. When I was talking at noon today, somebody said it's too bad Jean Farley isn't here, and I sort of sensed when I walked through the department, he's really there. So tonight, let me talk about a few things. I see these tremendous changes going on in healthcare. I talked earlier today about disruptions and how we can be positive disruptors, but I want to talk tonight a little bit about some signs I'm seeing that healthcare could go in a tremendously positive direction, especially for those of us in primary care services. Let's talk about, first, some movement away from bricks and mortar into real access for patients. So this little device is pretty incredible in what it's done in the last 10 years. And I think it's going to force us to think differently about how our patients interact with us, access us, and help us to think less about hospitals and clinics and locations and more about the interaction with the patients that we serve. So that is a trend that I see as being very positive because healthcare's been way too bricks and mortar focused for a long time. Second trend that I see as positive is a movement away from sick care to something more like what we've all been wanting for a long time around wellness and prevention. And we'll never get away from sick care completely. We're here to serve people when they are ill. But if we do our jobs right, we're going to meet them along that path and help them to live really well as they move along. So with that change, what I see for our 35,000 employees at Aurora is a movement from what we've called caregivers to health champions. And when we get there, that'll be a significant change. We're early in that process, but that's part of this movement away from sick care. We also see a great movement away from passive patients to very active consumers. Anytime I can partner with a patient, I'm really happy because I think they get better care if they're well informed. And we're finally moving down that path away from volume to value and outcomes. And that's going to take a number of years of sort of schizophrenic payment systems for all of us, but we're going to get there. And finally, in this movement away from sick care to well care, when we think about meeting patients where they are, I think there's a really important opportunity here. I shared at noontime that when I was educated, we were taught we should treat every patient the same. That's how you get good outcomes. That's how we get rid of disparities. And in fact, I think everybody in this room knows that every patient and every family is different. They bring their own story and wealth of information with them. And as we heard from John, it may not be recorded well in the medical record, but it's there. And our ability to embrace diversity and inclusion and meet people where they're at and welcome them in however they come to us, that's a real opportunity, and I think we can create that. So I've talked about two trends, away from bricks and mortar and a trend toward a focus on wellness that I think we can help drive as family doctors. The third trend is innovation. And I know I'll see some rolling of eyes when I mention a couple of these things, but let's talk about it in terms of global innovation. For those of you who completely dislike the electronic medical record, let me reframe it around what it's meant for our patients. For our patients, it's meant millions less drug errors every year because of handwriting errors and drug interactions. So from a patient's perspective, if nothing else, the electronic medical record's been really a good thing, a good innovation. For me as a family doc, I still see patients very part-time. When I'm in the exam room, I rarely leave the exam room. When I started in my practice, I was running in and out all the time to try to get papers to understand what a consultant said or what the EKG looked like. I don't do that anymore. I really have FaceTime with my patients. So electronic health records, one example. Telehealth visits. Telehealth, I think, is a double-edged sword. I think it is a little bit of a danger to the relationship that we establish with patients, but if we use it right, it can be a really positive innovation. And I mentioned today at noon, the way that we're using it at Aurora is primarily for psychiatric patients in northern Wisconsin where we can never get a psychiatrist. We simply can't get one there. So for those patients, telehealth has been a really wonderful thing. And then let me talk about an innovation that's much more about process. At Aurora Sinai, the last Central City Hospital in Milwaukee, we have a lot of people who have used the emergency room for primary care for generations. We decided last year to try a different approach on something to do about that. We looked at the 110 highest utilizers in our emergency room. We hired social workers to case manage those individuals. We got them established with primary care practices, and we made sure that if they were coming to the emergency room, there was a really good reason. For those 110 patients, we reduced utilization by more than 60%, and we've saved an average of $30,000 per patient that we can reinvest in some other patients who are more appropriately there in the emergency department. That's an innovation that may not sound real exciting, but it's a real change in the way we deliver care. So we talked about away from bricks and mortar, move toward wellness, and innovation. And then I want to talk just a little bit about community collaborations, because this is the Farley legacy and their gift to me. And a little bit of it is back to the future. I remember in the early 90s, sitting in a conference room at Aurora Sinai with Gene Farley, looking across the table at him with those tremendous eyebrows like I've never seen again. They were something. And Gene started to educate me about communities as I was talking about disparities in Milwaukee and what we could do differently. He began to introduce me to ideas of models that have been used in Cuba and other countries of community navigators who really help patients to get what they need regardless of training, to create new kinds of access. And I think what he taught me in that particular session was it's time for us to stop trying to go it alone as healthcare providers. We need to learn how to partner and collaborate much more effectively. So for the leaders at Aurora, and we have a couple of them here with us tonight, I asked them to innovate, and I asked them to collaborate with other organizations, which they do. But most importantly, I think we all have an opportunity as family doctors in this department and elsewhere to be conveners. And we shouldn't lose the importance, we shouldn't lose sight of the importance of convening the right people in a room together, stimulating conversation, and changing the way care is delivered. So about 2 years ago, we had a very good year financially at Aurora. And what we did at that point was establish something called the Better Together Fund. And in the last 2 years, we've funded $15 million to over 4 dozen organizations into the community to enhance care. And we had a couple of rules with this. First of all, it can't benefit Aurora. That's one of the screening criteria. And it has to be related to one of 3 things that we know from our community needs assessment are highest needs in Milwaukee: primary care access, behavioral health, and sexual assault and domestic violence. So that's where we've invested the funds. And the important thing, maybe more important than the money, is being a convener has caused groups to come together that were working in parallel. And we all know what happens. Really well-intentioned groups and communities are running parallel on an issue and they never get traction. Putting these groups together, we now have networks of people working on sexual assault and domestic violence, and we have good data to show that we're making some headway there. And we have a real effort at behavioral health. And I don't know about the people in this room, but I've yet to meet a family who hasn't been touched by either mental health or substance abuse. So we're trying to hone in on those things that make a real difference. And I have to tell you, if I hadn't had mentors like Gene, I'm not sure that that sort of thing would have happened. That's the kind of impact that you all can have on people around you every single day. So tonight's, this is really very meaningful to me. Gene holds a very special place in my heart. And if you had told me when I was finishing my residency that I was going to end up as CEO of a large health system, I would have laughed. That's not what I went to medical school for. It's not what I went into academics for. But I do think the mentors I had along the way convinced me that I could make a difference if I was willing to put myself out there and take some risks and try different kinds of things. And Gene was very instrumental in that. Along the way, I've tried to stay very true to my family practice roots, and I think there are some things that I try to use to guide me. One of them is having a personal purpose. We all have to have a reason to do this. Family medicine isn't an easy world to be in, and if you don't have a personal purpose that ties you to it, this is probably not the right place. Listening. If we're good listeners, we end up doing a great job for our patients or our health systems or our communities. And finally, not being complacent. Rather than resisting the change that we're all feeling in healthcare, I think we can embrace it and say, how do we make this better? We have a lot of people depending on us. I have a message I've been delivering to our doctors at Aurora. When we hear people complaining about the ping pong ball that healthcare has become in Washington, I get really frustrated with that, and I wish it weren't that way. I wish we could settle into a model that's good for our patients. But we have to remember the anxiety that that provokes in our doctors and in our patients. So the message is, in spite of all the noise out there, we're here to take care of you. That's what we went into this profession for. That's what's going to happen. We will be here and we'll figure out the complexities, and we'll figure it out in a way that's good for the communities we serve. So for those kind of messages that live in here in me, I have to thank the people that I was exposed to, because as Cindy said well, we are really reflections of what we've been exposed to, and I think we're very fortunate to live in a state like Wisconsin with high quality care, and to be in a profession like family medicine that makes a real difference for patients every single day. Thank you.